So, what are the chances of full recovery if the cancer is detected early?
It's like almost 90%, 90 to 95% chances of cure today.
Many people avoid screening out of fear. And how can the mindset be changed?
If we detect it early or even before the cancer has actually set in, then that is the best time to intervene and cure for the rest of life. Robotic surgery has revolutionized the entire surgical branch, not only in cancer surgery, but in urology, in general surgery, gynecology. The added advantage of robotic surgery is there are certain areas where the laparoscope or the open technique, we would find it difficult to access.
Hello and welcome to the Care Compass. I am your host Subodh Simha, and in this episode, we explore the world of surgical oncology, where science, skill, and compassion come together to save lives. Joining us today is Dr. Kumar Vinchurkar, a renowned surgical oncologist from KLE Cancer Hospital, Belagavi, India. Dr. Vinchurkar, welcome to the Care Compass. It's a pleasure to have you with us today. To begin with, could you share a bit about your background, sir?
Yeah, so good afternoon, everyone, and good afternoon, Subodh, again. So, my journey with cancer surgery began way back in 2006. I started my training in Calcutta, West Bengal, and in March 2006, and completed in 2009. After that, I traveled to Mumbai, where I worked at Kokilaben Dhirubhai Ambani Hospital in the surgical oncology department. Then I shifted to Tata Memorial Hospital, Parel, Mumbai, where I worked again in surgical oncology, and I was there till 2012.
Okay.
In 2012, on the occasion of World Cancer Day, 4th Feb, I joined KLES Dr. Prabhakar Kore Hospital and Medical Research Center as the consultant surgical oncologist. Since then, I am working here as the cancer surgeon.
Right, doctor. So, what inspired you to choose cancer surgery as your specialization?
Yeah, so during my general surgery training, I realized that cancer surgery is really challenging, and at the same time, if you hone the skills properly, definitely the results are very good. And it's not only about the surgical skills; it is about the multidisciplinary approach, which really fascinated me. Some tumors would require a combination of, either medical oncology, radiation oncology, and surgical oncology, and some tumors may be cured only by surgical oncology. So the knowledge that was required is found, and I was, very much keen in understanding the details of cancer and treat the cancer patients. Apart from the surgical skills required, the techniques that I saw during my general surgery training inspired me to shift to surgical oncology as my final career destination.
Correct.
Thank
Very
you.
interesting, doctor. Talking from the common man's perspective, many people get scared the moment they hear the word cancer. What should people really know about it?
Yeah, so I would say that one should consider in today's era cancer as a chronic disease, just like what one considers diabetes or hypertension. Because in diabetes and hypertension, you would be visiting your physician, your cardiologist, or your endocrinologist for the entire life. Similarly, in cancer, there are treatment options available. Once the treatment is completed, you are expected to visit your oncologist on regular basis to identify the if there is any recurrence, if there is any need to change the medicines or to do any further investigations. So today, I would say that please don't get scared even if diagnosed with cancer. We have very good treatment options available and in various modalities. Like even in surgery, we have moved on from big incisions or multiple stitches to a few stitches, or a minimal invasive surgery where we use a laparoscope or even a robot to remove tumors. Then we have good support from the medical oncology in the form of improvised chemotherapy drugs, targeted therapies, immunotherapy. even from the radiation department, the machines have been updated to such an extent that the side effects are very minimal. So I would urge to the general population that please don't get scared if diagnosed with cancer. Please consult the oncologist and follow the treatment protocol given by your oncologist.
So cancer is reversible, right? That's exactly what you mean by that, correct? It's
I can say that cancer is curable today
curable,
if
curable.
detected. Yeah. So if detected early. So
Early.
please do not neglect any change in your body habit.
Mhm.
I would like to give you an example. For example, if I have a sore throat, usually it gets cured within 7 days, maximum 2 weeks.
Right.
But if
Yeah.
it persists, then one should definitely go to a specialist to confirm that there is nothing which is really very serious, and
Mhm.
to get diagnosed why the sore throat or the symptoms of sore throat are persisting for more than 10
Persistence
days,
from, yeah.
12 days. So if
Yeah.
diagnosed early, definitely there is a chance for cure in cancer.
Talking about some of those early warning signs or symptoms that people often miss. One such thing just now we talked about, right? If somebody has a persistent sore
So
throat,
yeah,
it could be one of those things. Likewise, how many such things are there which can be
yeah,
taken as early warning signs or symptoms? Yeah.
Yeah, I think it's a very good question because people don't realize the change in their body and then they come very late to us. So one thing that I mentioned is we'll start from the oral cavity. So any ulcer or any wound in the oral cavity that doesn't heal within 8 to 10 days should be definitely brought to the notice of the specialist. So that could be a foul smell from the oral cavity. There could be a non-healing ulcer. There could be bleeding from the oral cavity. So all these things definitely one should take serious. Then there would be swellings in the neck. It could be a lymph node swelling, it could be a thyroid swelling, or it could be a parotid swelling. So most of the lymph nodes, if you have any infection in the head and neck area, in the scalp or in the tooth or in the ear, you may get lymph nodes in the neck, but they usually subside within 8 days of treatment. If they don't subside, then definitely you should consult the specialist. Likewise, with thyroid swellings, parotid swellings. Then once you come below the clavicle, for most of the women, it is the breast cancer. I would like to tell you here that uh, today breast cancer is the commonest cancer among women in India and across the globe. So uh, we have to be really educating our female counterparts about this thing. Any lump that is felt in the breast should be brought to the notice of the doctors. Having said this, all lumps may not be cancer. All tumor that is palpable in the breast may not be cancer. But I would like to tell you all that you are not doctors, so please consult the specialist to say that yes, this is not a cancer and this is a benign tumor. So always, whenever there is a lump, there is discharge from the nipple, or there is swelling in the axilla. This
Right.
part we call as the axilla. So if you notice a swelling there also, please your specialist. Then comes the food pipe. So if you have difficulty in swallowing, then that is a sign of cancer. The other symptoms that come across is if you're vomiting, you have had food yesterday, and today morning when you vomit, the same food is coming out, and it is happening repeatedly. That is one more sign of cancer. Other than that, there is swelling or distension of the abdomen, or there is a palpable mass in the abdomen. Then definitely you should consult the specialist. If you come back to the kidney and the urinary bladder, the urethra and all, the penis and the vulva vagina, here many of them would notice blood in their urine. So blood in urine can happen because of stone disease also. But stone disease is usually associated with pain, whereas in cancer it is blood in the urine without any pain. So it can happen at the beginning of the flow, it can happen at the end of the flow, or it can happen throughout the flow of urine. So all these things definitely point towards cancer. Then comes the large intestine, where there would be altered bowel habits. Few days you have constipation, then you have loose motions, again constipation, again loose motions. So this is another sign of cancer. In the rectal cancers or in the left-sided cancers, many of them would have bleeding through the rectum, bleeding in the stools. So this is also a sign of cancer. Having said this, many benign conditions such as fissures and piles, in those conditions also the patients may get blood in stools. So that's why I always say that if it doesn't get cured within 8 days or 2 weeks time, you should consult the specialist. Similarly, for female cancers, the commonest cancer after breast cancer in women in India is the cervix cancer. So the common symptom is postcoital bleeding. That is, after having sex with the partner, there is some bleeding. So that is one of the common signs of cervix cancer. Apart from that, postmenopausal vaginal bleeding. That is, the lady has attained menopause, say at the age of 50, and then somewhere after 2-3 years, maybe at 52, 55 years of age, they notice that again the periods have started. So this is definitely a worrying sign. Apart from this, any swelling anywhere in the body, it could be over the bone, it could be over the muscle, it could be over the skin, definitely warrants consultation. And any change of the mold over the skin. Most of us have molds maybe since birth, but if there is any change in the size, color, shape, or number, definitely we should consult the specialist. Likewise, if there is any wound over the skin, any part of the skin, or especially the exposed part of this of our body, like face, hands, in such areas, if anyone notices a development of a new wound or an ulcer in our tongue, then it warrants consultation. Okay. Apart from this, weight loss is a sign of advanced cancer, and then some patients come to us with low backache, where the cancer must have spread to the bone. Some patients come with breathlessness, difficulty in breathing, the chest is full of water, or the stomach or the abdomen is full of water. So all these are signs of advanced cancer. Some patients may also present with persistent headache and vomiting. We call it as a projectile vomiting. So all these are suggestive of advanced cancer. Now, whatever symptoms I have told you about cancer, they're quite overlapping. As I mentioned earlier, sore throat can be just a viral infection.
Very true. Yes.
Similarly, bleeding through the stools can be just because of fissure or piles. But all these things, whichever if it is not cancer, it should get cured within 2 weeks' time. If it is taking more time, then definitely you should step up and you should go to a higher specialist for consultation and rule out something which everyone is getting scared of. So these are the things. They are overlapping symptoms, but you have to be careful enough to identify the duration and then go to the higher specialist.
Right. So I was just thinking that looks it's very overlapping. In fact, what you said rightly. If I have a sore throat and if it persists for a long time, I might think that I can take some antibiotics and solve the problem instead of going to a to the doctor and get diagnosed, right? So rightly pointed out, doctor. Overlapping. So if such signs or the symptoms look like it is for that, but it could be something else lurking within the inside the body.
We come across many even educated people. They say, I had this worry more breast for almost 1 year, which it did not create any problem. So I didn't come. Then now I had backache. I consulted one orthopedic surgeon, and evaluation he said that this is not a regular backache. We have to cancel the cancer specialist. So this is the common scenario even today. At least 30% of the patients they are unable to identify the change in their body, and this will delay in diagnosis.
So, what exactly happens inside the body when cancer begins to form?
Yeah, so it is actually an uncontrolled growth of the cells. So, there is wear and tear in the body as it happens with any machine or anything. But whenever the cell the growth of the cell becomes uncontrolled because of some changes at the genetic level,
Yeah.
then it gives rise to a tumor, and that is what is known as cancer.
Perfect.
So the common causes of cancer, I would like to tell here,
Yeah.
it's very important because these are preventable things. The most common thing that we are seeing nowadays is consumption of tobacco. Whether the individual consumes, has tobacco in the form of gutka, in the form of cigarettes, BDs, or any other form, one of the most dangerous, habits that an individual can have. And earlier it was thought that it would be restricted only to the oral cavity or the lungs. But today, science has proved that tobacco can affect each and every organ in an individual's body. A urinary bladder cancer, a kidney cancer, a pancreatic cancer, you name the organ, and all the organs have tobacco consumption as one of the cause for developing cancer. This is avoidable. This is preventable. So I urge that whosoever is consuming tobacco, they should enroll themselves in a proper de-addiction protocol and must stay away from all forms of tobacco. It's not only tobacco, but even alcohol is
Yeah.
one more, uh,
Good.
one more habit which encourages or develops the cancer, helps in contributes in developing cancer.
You just now talked about genetics. I just wanted to add other two parameters. Now, on the, compared to genetics as well as the lifestyle and the environment, right? Which one has actually a high influence on the cancer risk?
Yeah, so genetics is not in our hands. It is whatever has been transmitted from our generations to whether it is there. But I would like to give more importance to the modifiable risk factors, which you have actually mentioned. Lifestyle factors.
Lifestyle.
Very, very important. Environmental factors, very important. So all these points, are in our control. For example, obesity is nowadays considered to be a risk factor for developing breast cancer, ovarian cancer, endometrial cancer. And so, how can you prevent obesity? You can prevent obesity by doing regular physical activity. You can prevent obesity by consuming the right form of food. So, these things are in our control. So, what is recommended is 150 minutes of moderate physical activity in a week. I'm not saying that you have to do 150 minutes daily. It is in a week. So daily, if you can spare 30 minutes and do some moderate physical activity in the form of jogging or a brisk walk or a gym or yoga, definitely you will not become obese. And the other causes for obesity, apart from this physical inactivity, is the diet. So, the diet that is rich in green leafy vegetables and fruits is recommended so that you won't become obese. People who consume lot of red meat or people who consume lot of junk food are more prone for developing obesity, and in turn they would invite many cancers. So I would recommend that the lifestyle modifications that are important are stay away from alcohol, stay away from tobacco, do moderate physical activity, eat healthy food, stay away from junk food, stay away from sport food.
So, what are the chances of full recovery if the cancer is detected early?
As I mentioned earlier, it's like almost 90%, 90 to 95% chances of cure today. For example, breast cancer case, we can definitely say if it is diagnosed in stage 1 and if they complete the treatment that we have prescribed, the chances of cure are up to 95%. Having said that, even a few advanced cases, suppose if the patient comes in stage 3, it doesn't mean that I don't have any hope. Definitely, we have good treatment options available. Only thing we'll have to use multimodal approaches. Like a stage 1 cancer may get cured only with surgery or maybe only with radiation or chemotherapy. But if it is stage 3 cancer or a stage 2 cancer, such patients would require a combination of maybe surgery, chemotherapy, and radiation therapy. So yes, definitely earlier stages they have higher chances of cure, but even in the latest stages of the disease, there are chances of cure. So please don't get disheartened. Please complete the treatment prescribed by your oncologist and do go for regular follow. It is very, very important.
So talking about stress, we all know that it definitely affects the blood pressure and mental health, as well as the digestion disorders and all, right? But can it also increase the cancer risk?
Yeah,
Stress?
so stress may not directly increase the cancer risk, but once diagnosed with cancer and if the patient continues to be under stress, then the treatment part may get affected because of stress. The overall cancer treatment definitely gets hampered in the similar way, like what happens if the patient is obese. A physically fit patient can sustain the treatment of cancer very easily, whereas an obese patient or a patient who is under stress, physical stress or mental stress, definitely would not tolerate the treatment in the same way that a physically fit and the calm, stress-free patient would want.
So talking about the screening test for the early detection of cancer, you did talk a bit about it. If that can be elaborated a bit more, and
Yeah.
somebody, So
in India and in Asia, the common cancers that we come across include the breast cancer and cervix cancer. So the recommendations nowadays are at the age of 40 years, who are once every 2 years mammography and making breast examination. That is, I don't have anything now, but even then I would go to consult a specialist and get examined. So once in 3 months or 6 months, clinical breast examination, and then a mammography once in 2 years. So if this is for an individual who has a routine risk, who doesn't have any family history of any sort of cancer, but if the patient has a family history of cancer, for example, of breast cancer or colon cancer, then the screening would start quite early and the visits may be quite frequent, and maybe you would end up doing few additional tests apart from the basic ones.
Many people avoid screening out of fear. And how can the mindset be changed?
It's a very good question because when I say that I don't have any symptoms, why should I go to the doctor and get tested? And what if something wrong happens? So the only answer to this is if we detect it early or even before the cancer has actually set in, then that is the best time to intervene and cure for the rest of life. Now, everyone must have heard about Angelina Jolie. She's a actress who voluntarily underwent testing for breast cancer genes, and it was detected that she has those mutated genes, and she underwent bilateral mastectomy. She got both her breast removed and replaced with reconstruction. So this is an example where she's still doing very well. She's absolutely fine. So if there is definitely a risk in the family, or if there are pre-cancerous symptoms, we treat. If we intervene at the right time, the chances of cure are maximum. And this is the only explanation that I can give to any individual who is getting scared for getting screened.
When someone is diagnosed with the cancer, what should be their immediate next steps?
Yeah, so first thing is accept that it has been confirmed that it is cancer. Then and realize that the cancer is a separate specialty. Try to find out the specialist in your region or the best wherever you want to go. See that the cancer specialist is managing you, and then whatever investigations are required, the cancer specialist will advise and follow all those instructions. Don't get panic. Whatever stage it is, we have solutions for each and every stage. Most of the cancers have four stages: stage 1, 2, 3, and 4 stages. Even in stage 4, which is supposed to be that cancer is spread everywhere in the body, even in stage 4, we have options where we can prolong the survival of the individual, and at the same time, we can improve the quality of life. It should not happen that I will survive for next 2 years and 3 years or 5 years, and then most of the time I'm on the bed. No. So we have treatment options available where the quality of life also improves, and the survival also increases even if it is stage 4. And in stage 1, 2, 3, definitely we would strive to cure the patient completely. So the only urge is, you should accept that it is cancer, diagnosed cancer and confirmed cancer, and complete the treatment. This is what I would tell the general population.
Just talking about robotic surgery, in fact, you just touched that point at the very beginning of this conversation, right? How
Yeah.
is it different from traditional surgery, and when is it preferred?
Robotic surgery has revolutionized the entire surgical branch, not only in cancer surgery, but in urology, in general surgery, in gynecology. In cancer surgery specifically, I would like to say that we can avoid the bigger incisions which you were taking earlier when we were doing open surgeries. The added advantage of robotic surgery is there are certain areas where the laparoscope or the open technique, we would find it difficult to access. For example, very low in the rectum or the anal canal area. So in these areas, robot does a fantastic job. It takes the surgeon as close to the anatomy as possible and helps conducting meticulous fine dissection, identifying and preserving very fine important captures in the form of nerves and vessels. Similarly, the same thing is applicable in chest where foot pipe cancer or esophageal cancer, where we work in a very small, limited area. So robotic surgery has definitely an advantage in areas which are difficult to access by the traditional methods of surgery.
Okay, getting the accreditations from NABH or JCIs, right? For which a common person, like anybody as a patient and patient family, don't really know what exactly that means, right? So, could you explain in simple terms that what these accreditations are, and why does it matter, and how they are actually benefit patients during their treatment?
Yeah, so it's very important question, and I'm happy to convey that our hospital has been accredited NABH A plus. So this is the National Accreditation Board for Hospitals, and what it does is uh, they look at all the various aspects. For example, not only at the infrastructure. Infrastructure is one part of it, but apart from that, how the patients are managed in the hospital. For example, I'm a cancer specialist. So whether I'm conducting the tumor board or whether I'm taking the decision independently without consulting other specialists. It is very important in cancer because we should consider the treatment modality which has least morbidity. Oral cavity cancer can be treated with surgery alone or with radiation alone. But then we discuss in the tumor board as to which modality would cause minimum morbidity with this particular patient, and then take the final decision. So NABH looks when the assessors come, they look at all these things: the infrastructure, the doctor-patient interaction, the nurse-patient interaction, the doctor to the nurse interaction, the assistant interaction, the time, the waiting period in the OPD, the waiting period in the ward to attend the emergency and the semi-emergency call. If there is a cross-specialty need, for example, many of our patients would be diabetic. So if I give a reference to the diabetologist, how fast does that consultation get over? So all these things are taken into consideration before the hospital gets accreditation. And I'm happy to say that we have gone through all those things and we have been accredited with the NABH. And definitely, all these things indirectly will convey the patient that you are in a safe hospital and in a safe environment with safe doctors as well as the paramedical staff. because it is not only the doctors, but even the paramedical staff in the from nursing department, the laboratory personnel, all these things are important. So before accreditation, all these things are taken into consideration by the board, and only then they give us the accreditation. So I would definitely say that I'm happy and I'm proud that I'm working in an NABH accredited hospital where the patients can come comfortably. There is no stress about how would be the care here or anything. So everything is in a systematic pattern, and definitely they can come and comfortably complete the treatment.
Talking about palliative care, which is misunderstood as a end of the life or something like that, right? So, what exactly is a palliative care, and how does it help the patients during the cancer journey?
It brought up a very important aspect here, Subodh. What I would like to say is, rightly, as you rightly pointed out, end of life care is completely different and palliative care is completely different. So when I say palliative care, it is to make my life comfortable. I don't know how long I'm going to survive, which is usually in the advanced cancers where we talk about palliative care. But in our hospital, what we do is we integrate the palliative care for specialists from day one, which is very important because even the patient, unless they are familiar with the doctors, they would not agree to the treatment. So from day one, if they know that these are the different specialists available, and when time comes, they would definitely be more comfortable in accepting the suggestions. So a palliative care it includes managing the dysphagia part, where even some patients may not be able to swallow, they may not be able to eat food properly. So for them, we may advise some feeding procedures in the form of Weil's tube or a esophageal stent or a duodenal stent or maybe a feeding jejunostomy or a gastrostomy. So these are called palliative procedures. Similarly, if the patient has difficulty in passing stools or urine, we will definitely help them by doing certain palliative procedures. Having said this, it doesn't mean that all palliation is surgery is mandatory. No. So there are certain areas, for example, if the patient has severe low backache or whatever backache or bone pain, these can be palliated by giving radiation in a limited case to that particular area. Likewise, some patients would have uh, uh, you know difficulty in swallowing. So as I mentioned, stenting is one option. The other option is to give them palliative chemotherapy.
Right.
The other option is to give them palliative radiotherapy. So there are various options. The palliation means to make the individual's life more comfortable, to keep the patient symptom free, and it is not disease free but symptom free. The patient should be able to carry on the day-to-day routine activities and sleep as comfortably as possible at night. This is the intention of
Palliative care. So, how does the palliative care, the patient families and the caregivers, because they are also stressed up that time when the patient is there, right? So, emotionally and practically.
Yeah, so various aspects are involved here. We have to counsel the patient and the relatives as well. Many times they are reluctant to accept the palliative options that we give to them. So what we try to do is for example, if the patient is on a feeding jejunostomy, where the patient is not able to take anything through his mouth, so we put in a tube in the abdomen, in the jejunum, and we start feeding through that. So most common scenario that we come across is how can I manage this at home? So what we usually do is we ask them to get hospitalized for a couple of days. We show them how to feed, how to take care of those tubes, and then once they are comfortable, over a period of time, maybe in next 2 to 3 days, they realize that it is not very difficult. It can be managed at home, and then once they are comfortable, we send them home. Similarly, if the patient is a case of CA larynx or a hypopharynx who is having breathing difficulty, so the patient will require a tracheostomy. And then again, the same scenario starts. There are small children in my home. Is it possible to manage this at home? I am scared. I'm not a medico to change all these things. But mind you, I'll tell you, we have so many patients coming from nearby villages who are not even educated. But when they stay with us for say 2 to 3 days, we are we initially train them. Even our nursing staff helps them, and then once they are comfortable, we discharge them, and they come back for regular follow-up on OPD basis. Similarly, intractable pain, when we have exhausted with the available options, most of the options, then we resort to morphine. So we always tell them what are the side effects of morphine, when to come back to the hospital, and the follow-up schedule and all these things. So this is how we manage the palliative care here.
So, some of the common myths or misconceptions about cancer that you, as a surgical oncologist, often hear, doctor. What are those?
Yeah, so one of the most common thing now, whenever a suspected patient comes to me, I would say that I want to do a biopsy. So the first fear is whenever you do a biopsy, the cancer is going to spread. So this is the commonest myth that we come across. What I would like to tell here is the science has advanced so much that, for example, a breast tumor, say it is only 2 centimeter in size, I can very well remove it, and the patient will also be happy, and I am also happy, everything fine. But then the science has advanced so much that if I do a biopsy, I can know what type of cancer it is. Then I will do some special tests in the form of the ER, PR, HER2, and I'll come to know whether this patient would be better off treated only by surgery, or the patient needs chemotherapy first, let the tumor shrink, and then I will do surgery, and then maybe radiation. So, biopsy is one thing which everyone gets scared, and I would say that please do not hesitate to undergo biopsy. It is very, very important. There are different types. Even in cancer, some must be having squamous cell cancer of the esophagus, some may have adenocarcinoma of the esophagus. So, without doing and the treatment for each type of cancer is different. So,
Right.
without doing the biopsy, I won't be able to, target the treatment or plan the treatment properly for a particular individual. This is one aspect. Apart from this, what I mentioned earlier is people always talk about the side effects associated with the treatment of cancer. It could be side effect associated with surgery, with chemotherapy, with radiation, or anything. I would like to tell you one thing, that even if suppose if I am diagnosed with malaria and I take treatment, even that treatment has some side effects. Even anti-malarial drugs do cause severe gastritis. So are we not getting treated for that? Yes, we are getting treated for malaria, and we know that there are side effects, and we are ready to accept that. So similarly in cancer treatment also, yes, there are side effects, but I would like to tell you that we have better medicines today to manage those side effects. So please don't get scared. Even in surgery, what we are doing, we are trying to give you minimum side effects. Whatever it may be, a esophageal cancer surgery, it may be a breast cancer surgery, it may be an endometrial cancer surgery. The science is evolving. It has evolved over so many decades and is continuing to evolve, and we are incorporating all the latest advances in practice. So please do not get worried about the side effects of cancer. The other common thing that I come across is, most of them are elderly and they have grandchildren in their family. Then they're worried. The the grandparents usually tend to play with the grandchildren, feed them, take care of their schooling and everything. So they're really worried whether it will affect the grandchildren. So I would like to tell you, cancer is not contagious. Unlike COVID, the recent example which everyone knows, COVID used to spread from one individual to the other individual. Cancer is not at all a contagious disease. Please do not get scared or think that if you live in the same room, if you eat in the same plate, it may spread to the other person. So please do not think that it is a contagious disease. You can continue your regular emotional attachments. It should not be a problem.
We talked about the robotic surgery, and you did explain about where exactly it is used, right? Likewise, today's AI, which is everywhere, right, all pervasive. How AI is helping doctors to detect and treat cancer better today?
Yeah, so we have incorporated AI in, it's still under evolution. So what is happening is, as I mentioned earlier, for example, rectal cancer. So many times the patients who come to us, they are in stage 3. So what we do is we give them chemotherapy, radiation therapy first, and then we assess for surgery. Now, what AI will do here is they will it will give us a brief idea whether this patient would actually require a definitive surgery, or maybe with chemoradiation this patient is going to respond completely and we can avoid surgery completely. Likewise, there are some gray zones in the other areas as well. For example, in esophageal cancer. Nowadays, in esophageal cancer also we are giving sometimes only chemotherapy, sometimes chemotherapy and radiation therapy, and then we are taking up the patient for surgery. So these are the areas where the artificial intelligence will tell us whether this particular patient is likely to respond completely to chemoradiation, or that patient may require surgery. Likewise, in breast cancer, there are many indeterminate lesions where we are not able to identify whether it is going to be malignancy or it is going to be benign. So these areas, maybe the AI will help us, in demarcating between cancer and non-cancer. Having said this, we should take it with a pinch of salt because it is still under evolution. Maybe we may need another decade to rely completely upon AI. Finally, what is AI? It is the human information that is fed to the computer, and then the analysis part is done by the computer. So definitely AI has a very good future, but at present I would say that you have to be cautious about relying completely on AI.
Okay. So, how do you see India evolving in cancer awareness, prevention, and treatment?
What we have realized is most of the patients, maybe say about 2 decades ago, used to come in advanced stages, stage 3 and stage 4. So with such kind of podcast, what you are conducting, Subodh, it's very important because the simple things that I told you, a lump in the breast or a sore throat that doesn't resolve with regular treatment. So these things may go into their mind and they would come to the doctors earlier. So such kinds of awareness programs are being conducted by various institutions across the country. Tata Memorial Center is the lead institute in cancer. Apart from that, they have established satellite centers, and people like me who are trained in Tata Memorial Hospital and are practicing at small places like Belgaum and other places. Definitely, we are trying to transfer this information to the general population. We do visit the schools, we do visit the university colleges and the graduation colleges and educate the students and the teachers and the staff there about the signs and symptoms of cancer. And more important, what I am interested is in the modifiable risk factors that I mentioned earlier. So wherever I go for a talk, I always urge that they maintain a healthy lifestyle by avoiding alcohol, tobacco, by doing good physical activity, having healthy food, and all these things. So all the oncologists who are trained here, they are doing their job and they are educating the general population about the cancer, how to prevent it, and how to get treated. So this is how definitely the scenario is changing nowadays, and because of all this awareness, we are seeing quite a good number of cases coming to us in early stages.
So, before we wrap up, what's your message to people everywhere on how to stay aware and prevent cancer in their daily life?
Yeah, so first thing is, don't get scared by the term cancer. Cancer is no more synonymous with death. We have treatment options if diagnosed with cancer, but before that, what's in our hand is to have a physically active or avoid sedentary lifestyle, be physically active, avoid obesity by doing good physical activity and having the correct food in the form of the food that is rich in green leafy vegetables, fruits, and good quantity of proteins. So, and then whatever warning signs I have told you, signs and symptoms of cancer, please keep those in mind so that if there's any change in the body, you will definitely go to the specialist and get evaluated. Then, even if diagnosed with cancer, please don't get scared. Do not hesitate. Please consult the specialist and complete the treatment, which is very, very important. And if you follow all these things, I'm sure the future is bright.
Thank you, Dr. Vichurkar, for joining the Care Compass and sharing your valuable insights. Thank you.
My pleasure. Thank you. Thank you, sir.
Hope you found this conversation meaningful. Don't forget to like, share, and subscribe. Your support helps us reach more people seeking trustworthy health guidance. Until next time, stay informed, stay healthy, and take care.